Hey, everybody, and welcome back to another episode of the Into the Arena podcast with me, your host, Sean Corcoran, and our co-host, Andrew Wood. Andrew, how are you today?
I'm good, man. How are you?
I am awesome. Today's going to be a fun conversation. We're going to talk about pregnancy centers. We're going to talk about the criticisms of pregnancy centers, the legal actions that some states are taking against pregnancy resource centers. We're going to talk about the services they actually provide. So we're going to get into what the criticisms are and what the truth is of the pregnancy centers, because the truth is that the pregnancy centers are the boots on the ground in the pro-life movement. They are the heart of the pro-life movement. They are in there every day working with the men and women who are facing unplanned pregnancies. They are counseling them. They are helping them. They are providing medical services. And despite the lies of the opposition, we now have plenty of evidence and data to support that. We will be linking the data that we cite, or the opposition for Planned Parenthood. We'll be linking some of the news articles related to legal challenges that the pregnancy centers are dealing with, and we will also be linking in the show notes the data from the fiscal year 2024 showing the services that pregnancy centers actually provided and the composition of the pregnancy centers. So before we get started, I'm going to ask you to go ahead and subscribe to our YouTube channel. Click that like button on the bottom of the video and share this video with anyone you know who supports pregnancy centers, who works in pregnancy centers, or anyone who has questions about pregnancy centers and whether or not they're legitimate in what they're doing, because that's the question that we're really going to be getting to the heart of today. I think that before we get into the criticisms of pregnancy centers, Andrew, because of your experience, and I've served on the board of a pregnancy center. Both of us have worked hand in hand with pregnancy centers in their fundraising needs. You've worked for CareNet, which has 1,000, 2,000.
Yeah, a little over 1,500 affiliates. Yeah,
affiliates. So you've worked hand in hand with pregnancy centers for years, but you were also the executive director of a pregnancy center. So can you tell us a little bit about your experience being immersed in that as an executive director of a pregnancy center, like what you saw day to day, what the pregnancy center did, what they offered, and those services may be different now. They may be more services now than there were, years ago when you were ahead of it, because everything grows. But
sure.
What is your experience in pregnancy centers?
Yeah, I mean, my first connection to a pregnancy center was when I was, 17, 18. The local pregnancy center in my hometown, I knew the folks that led it. I filled up a baby bottle. I think, I was probably 18 years old. The director of that center had a cute daughter, and I wanted her to know I cared about the things that she cared about. And so I filled up a baby bottle of change, put a note in there, because I didn't want to do it anonymously. I needed her to know that the redheaded guy in the town did it. So nothing ever came of that, obviously, thank God. But that was my first interaction with a pregnancy center. Even in that moment, I knew there's an organization in our community that when folks are facing unplanned pregnancies, there's a place for them to go. And then fast forward, we ultimately moved to Knoxville in 2008. And then I began leading a pregnancy center in Knoxville that had been there since 1997. I started leading that in 2015. And it was incredible. I mean, it was a fixture in the community. The Knox County Health Department would send clients and patients to us for pregnancy tests or STI testing or ultrasounds even. And we were a fixture in the community. And it always amazed me that there were folks that would have opposition to the work that was being done. And most of the folks that had opposition to the work that was being done inside the pregnancy center had never themselves been inside of a pregnancy center. And so what were they doing? They were reading the articles. They were listening to Elizabeth Warren spout nonsense in Massachusetts about pregnancy centers, misinforming women or, lying to women. Again, all that is just not true. What we were doing, we're stepping into moments where people felt at a loss and they didn't know what to do. They didn't necessarily want to be pregnant, or maybe they wanted to be pregnant, but they didn't have the resources to continue that pregnancy. They didn't have a support system. Maybe they were in an abusive relationship, whatever it may be. And our medical staff and our non-medical staff stepped in and cared for them deeply. And so it always was interesting to me when folks would say, well, you're a fake clinic. That was one of the things that we would hear a lot. And I was like, we have 3 nurse practitioners on staff. We have 4 nurses on staff. We had a medical executive committee made up of OBs and family physicians. But sure, we're fake, I guess. We have more medical staff members than the abortion clinic, but I guess we're a fake clinic. It always blew my mind to see that. So when I was there, I made a point to, if the local news reached out, I said yes. And I went on, I did interviews, I had conversations as much as I could. I spoke at churches and other organizations, and because I wanted folks to know the great work that was being done, not to mention the heaviness that the pregnancy center staff and volunteers are carrying. For some of them, they may be the only one that recognizes that's a life on the ultrasound screen. And then that person could leave that pregnancy center and go have an abortion. And that nurse, that chaperone, that volunteer was the only one that recognized that to be a life. And so it's heavy, it's hard. One thing that stood out to me when 2020 hit and, everything came to a screeching halt, and they were saying only, how did they word it? Only the necessary offices could be open, essential. They said essential services only. Well, guess what? The health department reached out to our fake clinic and said, we really need you to stay open. You're essential. We're going to send any of our pregnancy tests, any of our STI clients, anything related to reproductive health, we're going to send your way. Notice they didn't send them to the abortion clinic. They sent them to the pregnancy center down the road because of the work that we were doing. And so we stayed open that entire time and served women and men that were in our community. So it is an honor, and I know you feel the same way, Sean. It's an honor to be a part of the pregnancy center community and to do what we get to do and to celebrate the work that they're doing all over the country.
Yeah, 100%. Nothing that Men for Life does would matter without without pregnancy centers. Once this fatherhood program is off the ground, it is going to be implemented by the pregnancy centers. Mm-hmm. And so, other than me just talking, which I like to do, and I will, but the work that we're doing to try to serve communities and to raise up good men, it can't happen if there's not someone willing to step in and implement the program, and that's where the pregnancy centers, come into play. And look, like you said, they are the ones who feel the heartbreak, right? In the instance that a mom comes in, sees the ultrasound, chooses an abortion anyway. So it's not a go to work every day, joy filled, we're going to win. While that's the attitude that they have to have, it comes with a negative emotional toll as well, that I don't feel, right? Being on the outside of it, that's something internal to the pregnancy centers. And so I think we have to give the directors and the staffs of the pregnancy centers, a lot of credit for not only the work that they do, but the heart that they have for the work that they do, for the women that come in, for the men that come in, for the babies that they're trying to save. It really is a level of God's work, and I'm grateful.
Well, and one thing that we used to hear, I'd even go into Christian context. I remember one time we were at an event, and a guy walks up and he, he's a member of a local church. He kind of led with, I'm a Christian. I believe in what y'all are doing. He said, but my issue with y'all, which I always think is funny, when they're like, they paint with a broad brush, is what are you going to do after that baby's born? As if we're not doing anything as the Christian community. No one is adopting more. No one is fostering more. No one is providing charity. No one is, look, the Christian, the local church and the capital C church as a whole is doing more of that than literally anyone.
Right.
Anyone. And so to argue, first off, it would be well worth our time to just save babies. And I say just, but it would be well worth our time. But we're not just doing that. We are providing parenting education after baby's born. We're providing and helping them find childcare. We're seeking to help them find vehicles if their cars broke down, to find housing, to get with OBs and medical professionals in the community. I've been in situations where we help people get jobs. So to argue that, oh, well, once baby's born, you don't care anymore, is such a lie from the pit of hell that, of course, the enemy is trying to stir that up in the hearts of folks to say, oh, you only care about baby. First off, I'm not going to apologize for caring about the baby. We certainly should, but it's so much more than that in the work that we're doing.
Right. And so I think that's, I do want to touch on one thing that you brought up, because I think it's really important, and we'll get back into this when we get to the data from the Lozier Institute report for 2024. But you brought up the medical staff and the fake clinics, and that's important, because what I'm about to read from is Planned Parenthood's fact sheet on pregnancy centers, and and it also uses the term fake clinics, right?
Of course,
but in 2024, there were, 2,575 pregnancy centers in the United States of America, 10,000 medical professionals, right? So that's an average of 4 medical professionals per pregnancy center. I have never worked with a pregnancy center that did not have a medical director, an OB, generally as a volunteer, who oversees the medical operations, but 10,000, medical staff working for these 2,500 pregnancy centers. So that's again, like you said, that's more than the abortion clinics, right?
Well, and two, if they were fake clinics, and this is the part that a lot of folks nowadays just either read the headline or they take their information from the abortion industry. But I can speak mainly from what I dealt with in Knoxville. If Knoxville was a fake clinic, the pregnancy center that I led, Hope Resource Center, give them a shout out. They're a great organization. If it was a fake clinic, the OBs over at the University of Tennessee wouldn't have referred patients to us. But guess what? They referred patients to us. If we were a fake clinic while my wife was getting ultrasounds with all of our pregnancies at the University of Tennessee, the medical staff at the University of Tennessee wouldn't have immediately recognized that I was with that pregnancy center and celebrated the work that we were doing.
Right.
So just on the face of it and on the surface level, it's just a ridiculous claim. And then what we know is in the abortion industry, even with what happened in Pennsylvania with Kermit Gosnell, he had 15-year-olds providing quote unquote care to clients walking in the door. Now, if you want to talk about a fake clinic, there you have it. Right. The pregnancy center would never do that. We're under so much scrutiny that we have to go above and beyond in the work that we're doing. And we always did and continue to do that. And so that's why what you've seen now is state networks have formed so that pregnancy centers within the state can hold each other accountable and say, hey, I heard this. How do we make this better? Let's talk through policies and procedures, and what you're doing is working there. How can we make it work here? Because we want to hold ourselves to a higher standard and do the work that the Lord has called us to do. So it's to me, it's laughable that the abortion industry that is literally designed to take away life is calling a pregnancy center a fake clinic when I've worked in them. And I've visited not just the one that I led, but all across the country. Right. And I know you have as well, to see, firsthand the work that they're doing in their communities.
Yeah. And yet they do. They call it, this is what the title of this document by Planned Parenthood says, crisis pregnancy centers are anti-choice, anti-abortion, faith-based fake clinics. Now there's a lot going on there, right? Like I would agree that the majority of pregnancy centers probably have a faith component.
Sure.
I don't think that means that they are bad. Most charities have a faith-based component, and that doesn't mean that they are bad, right? Like these services are provided free to the community, and whether people want to accept this or not, who is going to be volunteering and donating to provide free services to the community other than people who believe in Jesus Christ and are living to serve his mission, right? Like that's where we're going to be, and there's great people who are not Christians, and I'm not disregarding that, but by and large, if we're going to acknowledge that pregnancy centers have a faith-based component, of course they do. Because that's one of the things that we are called to as Christians to do, is to serve the community, to serve those who can't serve themselves, right? And to provide for those in need. And so as part of that calling, we're going to step into that. And so it makes sense that many charities, including pregnancy centers, would be faith-based. So I think, putting that on there is really, kind of distracting from whatever their message is. As far as anti-choice, I think that anti-choice is an interesting thing to say from an organization who 97% of the people who walk into Planned Parenthood walk out having had an abortion. They provided in this same reporting period, they provided over 400,000 abortions. They provided 2,100 adoption referrals. It was 187 abortions per adoption referral. You talk about choice, right? Like that's not providing choice. The abortion industry is not a pro-choice industry. It is a corporate giant making money off of abortion. They're selling abortion, and when you come in, that's what they're going to sell you. It's not about choice, and it's unfortunate that that is where society is at today. But the more we talk about it, the more people are going to realize it. The more we show the facts, the more people are going to realize it. Are they anti-abortion clinics? Yes. They are pro-choice pregnancy resource centers. Yes. Like we don't go in to volunteer our time and money to serve those in need by telling them to kill their babies. So yes, that's not actually a criticism. Like, pregnancy resource centers are not abortion clinics. And
I always, anytime I heard that, I always embraced it. I'm like, yeah, guilty as charged. I am anti-abortion. It's like when they say you have an agenda, and I'm like, yeah, and so do you. And so like this argument, like we're not allowed to have an agenda, or the progressive side of the coin, or the abortion industry doesn't have an agenda. Are you kidding me? Yeah. I used to say this till I was blue in my face. If they didn't have an agenda and they really believed about caring for women, as they call it, then they would provide all of their services at no cost. But guess what? They will never provide their services at no cost.
Right.
Ever. Because it is it's a cash cow. It is an industry. Yep. And so, although I would disagree with the abortion industry providing those services at no cost, at least that would be a conviction. That would be like, we care so much about this, we don't want you to pay a dime. Right. But they're never going to do that. Or they'll try to get the funds from the state so that me and you have to pay for it, even though we disagree with what they're doing.
That's right. And that 400,000 abortions that Planned Parenthood performed, come at a price to the client of somewhere upwards of $200 million for that year. And so when we get into later how they say, well, it's only a fraction, like 4% of the services we provide. Well, that's because you're counting each and every single pregnancy test as a service, each and every single STI test as a service. But those things that come at a cost of $1, per service, when we're talking about a corporate entity, my wife's a dentist, right? And so to suggest that, it'd be like suggesting that the majority of what she does is provide water and floss, right?
Yeah.
Like, because she doesn't do as many fillings as her hygienists floss teeth, right? Because not everybody needs a filling. But she's not making money by flossing teeth, right? The abortion industry is not making money with the STI tests. The abortion industry is not making money with the pregnancy tests. Like, if that's what they really provided and that's all they provided, they would not be able to keep their doors open. They provide abortions to the tune of about $200 million a year. And so I think that's a really important thing to point out. Now, what this fact sheet gets into is, here's the criticisms, and we can kind of talk about each one of them. The first one is, I'm going to try not to laugh because these people take this seriously, and I want to treat it seriously because it is the opposition. But some of it is laughable. So, no oversight. Financial oversight of taxpayer-funded pregnancy resource centers is severely lacking. In some states, no one has any idea where the money given to these centers is going or how it's being sent. So let's clear up, first of all, this taxpayer-funded pregnancy resource centers, okay? Only 18% of the pregnancy resource centers received any taxpayer money, okay? The other 82% are exclusively funded by donations, right, and grants. And so this isn't some from a business, Planned Parenthood, who was receiving $1 billion a year in government money, right, criticizing and then lying about where the money's going, criticizing pregnancy resource centers for receiving government money is really disingenuous. But the idea that no one has any idea where the money given now let's be clear. There's not one citation, not one source listed on this fact sheet. Like, this is like they hired Olivia, who is a college intern, to just write a bunch of random stuff on a paper and make it pretty. And so, I challenge them to show us where they're getting the data that in some states, no one has any idea where the money given to these centers is going or how it's being spent. Now, in your time as a director of a pregnancy resource center, did you have to keep data?
No, actually, we didn't even have computers, Sean. It was we just I kept it on a Post-it note and hope for the best. No, look, here's the thing. We are, it's crazy to me that first off, it's pennies compared to what the abortion industry is getting from the taxpayer. I mean, it's pennies what the pregnancy center gets versus what the abortion industry gets. And then second, if they want to have a conversation about wasteful spending and no oversight with government spending, I'm happy to have that conversation, because I do think that there's a lot of that. We are seeing that, but not to pregnancy centers. Like that's just not true. Even here in the state of Tennessee, some dollars are going to pregnancy centers. I know for a fact there's some pregnancy centers that still, even though it's available, won't take it. There's other pregnancy centers that we'll take it, but we're going to use it for very specific things. And at any point, if the state requires something that we don't agree with or believe in that goes against our value system, we will send money back. Whereas the abortion industry is seeking reimbursements for pretty much every service they provide, and then arguing that, well, no tax dollar is going toward abortion, as if we don't understand that budgets are fungible. Like, if I make money today and I put it in our checking account, and then I made money from here and put it in our checking account, but I say this money doesn't pay for, my gym membership. Yeah. Well, the reality is the money is all going into the same account. If I can rack up a bunch of dollars, it's going to allow me to do more abortions. That's what the abortion industry does. So we can bring in all these funds because we're taking every single thing that we do as a service. We can argue that only 3% of what we do is abortion, but all these dollars that we're receiving is allowing the abortion industry to provide more abortions. It's allowing them to influence policy. It's allowing them to lobby in Washington and across the country at state capitals. And so that is, of course, their government can always be better at oversight. I'm not going to argue against that. We do have a struggle with government oversight, but the amount of money that's going to the pregnancy center, the pregnancy centers are crossing all the T's, dotting all their I's. I mean, I've talked to folks here in the state of Tennessee about what they are required to provide to the state, and believe me, it is being looked at and scrutinized, and they're not just doing these things, willy-nilly.
Yeah. And, and other things like this document here by Planned Parenthood is not even, hiding that it is a document to promote abortion. Right. And so the creation, like paying Olivia, the college intern, to create this document, that costs money. However many times they had to print it, the website, like all of that costs money to promote and market abortions. All the Google AdWords, right? Like everything that they're doing to promote abortion is abortion related. And so it's like when I was doing family law, and people would object to the amount of child support. And, the objection, it would always be an emotional objection, but the objection would be, I want to see how every dollar that I'm giving her is being spent on this child. The issue with that is that part of the child support calculation is to cover the cost of gas in the car, right? To cover the cost of electricity in the house, to cover the cost of hot water, to cover the cost of the mortgage, of the homeowner's insurance, of the vehicle insurance, to kind of displace the total costs across the entire family. And so how do you make that determination, right? And it kind of gets into what you were saying is once the money goes in there, the money gets spent, and it would be impossible to say, here is where this dollar went, all the way down to the 3 cents, and it's unnecessary. Nobody's overseeing Planned Parenthood to ensure that they are not spending any dollars from the government on abortions. Like there's no oversight of that. They're just self-reporting whatever they want to self-report. But to the point of what we're talking about, that just gets into the hypocrisy of it. But to the point of what we're talking about, these are nonprofits, and nonprofits do have a fiduciary obligation to the donors. They have to file tax returns. They have to account for the money, and there's always going to be fraud in any industry, right? Like there's the potential for fraud, I should say, in any industry. And like you said, government oversight is not perfect, but that doesn't mean that people aren't keeping records and keeping track. How do you do inventory if you're not keeping records? How do you know if it's time to order more pregnancy tests? Like all of these things are necessary parts of running a business. There's not just money coming in and money going out with nobody knowing where it's going. And that's a ridiculous statement. The next thing that they bring up is no honesty. Crisis pregnancy centers deliberately lie about the medical effects of abortion. No, they don't. Abortions kill babies. Pregnancy centers are clear. Abortions kill babies. There's nothing to lie about. The only person lying about the medical effects of abortion is Planned Parenthood and the abortion industry, and about how far women are in their pregnancies so that they think they have more time to make a choice about abortion than they actually do. Look, there are abortion clinics opening that do abortions up to 34 weeks. It's not necessary to delay a pregnancy in order to get someone to a point where they can't have an abortion. If anything, the pregnancy centers would be better served if they're going to lie by saying the baby is farther along. Like this entire statement doesn't even make sense, right?
Well, and it's also to me, it's all you want to talk about a fake clinic. It's also just not medical. It's not good practice medically. When we went into the OB, what did they ask us? And we wanted our baby. We're going to the OB, and they say, "How far along do you think you are?" That's what they ask. And my wife will say, "I think I'm this far along, but I don't know." So what do? They determine how far along you are so that we can have the medical care that we need. Here's what happens in the abortion industry. I go online and I'm looking at abortion pills and it says, "How far along are you?" And I know that, well, the abortion pills are supposed to be for up to, say, 11 or 12 weeks. So I better keep it in that framework regardless. So I'm going to say that. And there's no oversight. You want to talk about oversight. There's no one saying, "Hey, come in for a checkup. We just need to make sure you're as far as you think you are. Maybe you're not. Maybe you're having a miscarriage." We need to check these things because that's how you practice good medicine. But instead, they're going, "Oh, okay, we'll just take your word for it. We'll send you the pills and we'll hope for the best." And so when a pregnancy center is bringing that client in and is trying to determine how far along they are, that is good medical practice. That is what we should be doing because we want to make sure that we're providing the care for that client. We had clients come in before that were like, "Yeah, I think I'm 10 or 11 weeks." And we do an ultrasound and we check and they're 25 weeks along. Now, if they'd have just gone online and told some distributor, I'm 10 weeks, they would have got abortion pills, and who knows what would have happened at their house. And so to make that argument, again, it is designed to, and that's why they didn't source anything. It's designed to just scare people and say pregnancy centers are podunk mom and pop shops that don't know what they're doing. They're just the little nice lady at the church trying to help and manipulate you. That's so far from the truth. There are a group of folks that are caring for the men and women that are walking through their door.
That's right. The next criticism is no choices. They advise women who have been sexually assaulted not to use emergency conception. And beyond this, they won't suggest any women use contraception for health issues or to prevent pregnancies. Now, there are dozens of videos at this point of people in Planned Parenthood saying that the girl is being trafficked, right? And Planned Parenthood workers advising them on how to hide this, right? So I think that for them to bring up sexual assault is just absolutely absurd. But these are pro-life pregnancy centers. Like they're not going to advise someone to use emergency contraception, which is, I assume they're talking about Plan B, which would be an abortifacient, right? And so or would end the pregnancy. Like no, you're right. Like that's not even a criticism. Like that's just, pregnancy centers are designed to help support life, and so they're not going to advise somebody to not, or to do something that would end a life.
Well, and again, what's the best medical practice? Is it to determine if there's a pregnancy at all, or is it to say go take a pill, just in case? Like that to me is. Again, just a knock on how they go about practicing their services. But yeah, a pregnancy center is not going to go out of their way to encourage a client to take something that's going to create a hostile environment where a baby won't survive. They're just not going to do it. And so again, we're not going to apologize for that. I think what I know and conversations I've had, what we saw firsthand, when folks were in those abusive relationships or came in and kind of shared that with us, we did everything we could to find them the help that they needed.
That's right.
We worked with partnering organizations that could get them in a safe spot away from an abusive partner. And so this is not, we didn't take those things lightly, certainly. And again, it just goes to show they haven't stepped foot in a pregnancy center and spent any time with them. I had a student one time from the University of Tennessee want to do an article. And, like I said earlier, I always said yes to those. Some people don't want to say yes to those, and that's fine. That's their prerogative. But this student, before he came in, I looked at his social media page, and I was like, oh, this is going to be fun. He is clearly not on our team. And he came in and he spent an hour and a half, 2 hours with me. And he kept posing these questions, and I kept answering him, and we walked through everything. And it was very cordial. He was nice. And, I showed him around and he met staff and, guess what never happened? That article never happened.
Yeah.
And I think it never happened. And maybe to his credit, he was like, I don't want to write anything that's going to praise them. And if I write anything that's negative, I'm going to have to lie. So I'm just not going to write anything. And that showed me that when folks take an opportunity to actually sit down and see what's happening inside he was blown away at our facility. He was blown away at the resources and the things that we had, but he had in his mind what he thought was a fake clinic. And when he got there, it was very clear it was not that. And I just think there's so many opportunities for those folks that are spend so much time hating on the work of the pregnancy centers to just go and see the amazing work. Go talk to a client that had their life transformed, that are now holding their baby because someone at a pregnancy center cared enough about them to sit down with them and cry with them, to pray with them, to provide the medical care that they needed.
Yeah, I had an experience where I had somebody criticizing my comments on pregnancy centers, and I said, well, based on what you're saying, it's clear that you have never been to one. I would love to take you and let you tour the one here. And then I got cussed out.
Yeah.
I got cussed out because they have it in their mind that this is what this is, and they're not going to believe it. It's just easier to stick your head in the sand, man. You know, and it's unfortunate. CPCs collect the same detailed personal medical information as a clinic, but are not required to keep it private like a doctor's office is. They reserve the right to reveal or sell personal info for morally compelling reasons. Now, in your time working with CareNet or with pregnancy centers, are you aware of any statement that reserves the right to reveal or sell personal info for morally compelling reasons?
Absolutely not. I mean, even I was one of the founders of the pregnancy center network in the state of Tennessee, and had a pregnancy center sold client information at any point, they would not have been a part of our network. And I can assure you of that. And so that, again, that there's no basis for that argument.
Right.
If that were happening, here's how I know that. If that were happening on a regular basis, the New York Times, you name the journalist, you name the entity, there would be stories everywhere. Yeah. Elizabeth Warren would be speaking on Capitol Hill about
100%.
This pregnancy center selling client information.
Yeah.
But there's no proof of that.
No proof.
Because if there were proof, we'd see it everywhere.
Right.
But we don't see it everywhere, which is why they weren't able to cite any documentation or any article for it. They just can throw nonsense out, right, hope it sticks, and then move on.
Right. And I think it's almost like they just said, because this isn't a doctor's office, they don't have to follow X. X requires this, therefore they can do the opposite of
right.
X. But that doesn't mean they do, and there's no evidence that they do, because, like you said, like it'd be everywhere. Like there'd be no question. There would be sources, right? There'd be several sources of investigations and news articles and lawsuits, right? If that were the case, and so this is just an outright lie. No separation. Okay, first of all, the idea of separation of church and state is ridiculous, because this is not a government entity. Whoever decided that it was a good idea to throw this in here doesn't understand anything about government or the Constitution. However, we'll address it because they brought it up. And it says, these are faith-based organizations that oppose abortion. Yes. They have religious missions and say they express the love of Jesus Christ. In many cases, that's true. Funding them with taxpayer money is a clear violation of separation of church and state. Again, these entities are not for the most part, receiving government money. But I think what's really important here is that what they're suggesting is that no entity at all which has any faith-based component can receive any government funds. That would mean that no Christian schools could receive any government funds. No homeless shelters that have a faith-based component could receive government funds. No, like organizations that provide clothing and food to those who need it. If they have any faith-based component.
Yeah. I mean, some hospitals, their founding is based in
the whole Christus network,
faith-based. Yeah, and so again, it's also acting as if, and I think definitions are important. Yes, we have a faith-based component. Yes, we're religious. Yes, all of those things. But to act as if the abortion industry and the progressive side of things do not have their own religion it may not be a sanctioned, structured religion, but it is definitely a religion. It is, they are going out of their way to make you and to make me spend our tax dollars to do things that oppose not just our value system, that oppose everything we literally stand for. And they claim this, separation of church and state. So what they're arguing is the government can do whatever they want to do, and anyone that has a faith background or a faith, value system has no right to oppose it, or
Right.
has no right to go lobby on the Hill for good and godly things. Of course, we have the right to do that. You want to talk about separation of church and state, which is not in the Constitution, but what they don't want to talk about is the First Amendment that allows us to speak clearly and do the things that we do. And so I just think it's it's a tactic to try to make it out like we're religious zealots, we're extremists, and all we want to do is evangelize and all these things. Look, would I call myself a zealot? Sure. They probably would definitely call my views on life extreme. But I would say their views on abortion are so much more extreme than my views on life that we're not even in there. It's not even worth having a conversation on. And so if you want to end the life of a child all the way up to birth, I simply want to protect the child from conception. Who's the extreme one? I mean, like it is. And so as we're having these conversations, they can throw the religion card out all they want, but we're not going to run from that. And I've talked to constitutional attorneys. I've talked to constitutional attorneys that work within state government who have said, you're fine. You keep doing what you're doing.
Yeah.
There's no issue here. And so I'm like, well, that's all I need to know.
And they're not only providing services to people who profess their love for Jesus Christ, right? They're providing services to everyone. And so it's not that it's a Christian organization. It's that many people who believe in Christ also believe that we should be helping people. And one of the ways that pregnancy centers help people is by providing the services that allow them and enable them the ability to provide for themselves, to support their families, to not have to feel compelled to have an abortion, and to provide them information so that they can really make an informed decision, because the abortion industry is only providing one side. This is what abortion is. We'll give you an abortion. They should welcome, if they believe in choice, someone providing information about the different choices. Now, nobody's chasing these people down if they leave and go get an abortion, right? There's no tying them down. There's no holding them down until the pregnancy is over. It is simply providing information so that they can make an informed choice. And if people are pro-choice, then they should support that above all. Just running through some facts here on the bottom of this sheet. They say there's about 4,000 operations across the United States. This is just bad research. As best I can tell, that 4,000 number comes from Heartbeat International's website. They have 4,000 affiliates throughout the world. Right. That doesn't just include pregnancy centers. It also includes maternity homes and other services. There's not 4,000 pregnancy centers in the United States, based on the Lozier report. There's 2,575. So, the number is probably closer to 3,000. Mm-hmm. They position themselves as small, local, and volunteer run, but more than 70% are affiliated with large, well-resourced networks, providing funding and legal muscle. How much money did CareNet
legal
provide
muscle. I love that.
To affiliates?
Well, I don't want to say zero, but very little. We certainly provided resources,
right?
Conversations, but to argue, I'll give you a snapshot. To argue that they are connected to they act like they're connected to some multi-$100-million national organizations.
Right.
There are pregnancy centers. Now, this might be a data point that shocks some folks. There are pregnancy centers in this country that have larger budgets than the national orgs that affiliate with them.
Right.
So again, I think it's important that we are honest about this. The national orgs are doing great work and are helping with policies and procedures and holding pregnancy centers accountable. Whether it be CareNet, Heartbeat, NIFLA, doing great work. ADF comes in. So you talk about the legal arm. ADF, Alliance Defending Freedom, they're going to help with, there's court cases in Illinois or court cases in the Northeast, New Jersey, whatever it may be. ADF comes in and provides that because why? Because the other entities don't have the funds to do it.
Right.
And so ADF that's what their mission is to help Christians live out what God has called them to live out within the framework of the Constitution in this country. And so, again, it's just not accurate. The budget of Planned Parenthood is more than all the pregnancy centers' budgets combined.
Right.
What Planned Parenthood
and
receives,
the national organizations.
Yes, what Planned Parenthood receives solely from the government. Depending on what numbers you're looking at, $500 million to $700 million is more. So what they receive from the government is more than all the pregnancy centers, all the national organizations combined.
That's right.
And so again, it's not just not fair. It is just an outright inaccurate statement to say that these pregnancy centers are partnered with large entities
Like
that work across the nation. Again, a quick research would show you that that's just not factually correct. Now, do a lot of the pregnancy centers work with national orgs? Of course they do. But they're not, these national orgs aren't, flush with cash. They don't have hundreds of millions of dollars that they're operating with. It's not accurate.
Right. So, and I think that since they bring up the affiliations, I think it's important to point out that earlier where they said nobody knows where the money's going and nobody knows what's happening.
Yeah.
In order to be affiliated with these, you have to provide the affiliating organization has to provide data on all the services provided.
Oh,
right?
so much data. I mean, so much information.
I mean, that's the real purpose of these national organizations is to collect the data, figure out what's working, figure out what's not working, and help those those pregnancy centers who may be failing or lacking in certain areas to understand how they could improve, right? Based on the data. It's all data. So in one point, they're saying that nobody knows what they're doing or how they're doing it. And the other point, they're pointing out that 70% of them are affiliated with organizations which require them to provide the data on what it is that they're doing. The next point is a full 80% of their websites have false or misleading information. Now, I think it's really important to point out here that while there is no data or no citation or no sources, Planned Parenthood does not believe that abortion is the intentional killing of an innocent human being. Therefore, if any website were to say that an abortion is the intentional killing of an innocent human life, that would be considered by Planned Parenthood to be false and misleading data. Or false and misleading information. So while we don't know how they got to their 80%, I mean, by their own numbers, right, that 80% is going to be closer to 3,500 pregnancy centers, and there's not even that many. So we can't really count on what Planned Parenthood's numbers say, but
well, and again, who went to every single website of a pregnancy center, and that's one thing that is at least with Planned Parenthood, you can go to their main website and you can see what they say they believe and what they stand for. And here's what I do know, that prior to Roe being overturned, on Planned Parenthood's website, they said that an ectopic pregnancy, to get a procedure done for an ectopic pregnancy is not a traditional abortion. No one's ever believed it to be a traditional abortion. It's a different kind of, the ectopic pregnancy, the baby in that moment, there is no chance of viability. And if somebody doesn't intervene, the baby and the mom will die.
Right.
And then Roe is overturned.
Yep.
And their website changes. Why? Because they wanted to scare women to think that pregnancy centers and other folks are not going to provide you the care if they find an ectopic pregnancy, which is just, again, a bold-faced lie. And so if anyone is misleading folks on their website, I would say it would be the abortion industry. But one thing the abortion industry does say is, we're going to come get an abortion and then you were pregnant and you're not pregnant. That is a true statement. But
Right.
There's so much more that goes into that. And so I just think it's kind of sloppy to just broad brush say that 80% or whatever the number was of websites are misleading. I don't know.
I mean, if they actually went to all the websites to determine that 80% number, then they would know that there's not 4,000 pregnancy centers in this country.
Right.
So if anything, this document in and of itself proves that on the Planned Parenthood website, there's misleading and false information. Nationally, an estimated $60 million in federal abstinence and marriage promotion funds have been directed to CPCs. That's not a criticism. Like, you know what prevents abortion? Abstinence. There's nothing wrong with that. In Planned Parenthood, if they believe in planning parenthood, should also support abstinence. So the idea that the government is giving money for abstinence education to someone who's willing to educate on abstinence is not a criticism. It's actually a win for the pregnancy centers. Marriage promotion funds, like, I don't know what that means, but I will tell you this: promoting marriage is not a negative thing. Like, I feel like you said, you used the word sloppy. I think that that this document in and of itself is a sloppy document. 87% claim abortion leads to breast cancer and future infertility, even though medical studies backed by the Mayo Clinic and American Cancer Society repeatedly found that no such links exist. There's no telling where they got that number from. 87% of pregnancy centers, 87% of their websites, 87% of what makes this claim. But there are studies that can be relied on for that information. I'm not up to date on those studies, so I'm not going to get into it. But that just seems like an arbitrary number that was thrown out there. Other scare tactics include citing the non-existent mental illness post-abortion syndrome. Nobody thinks that post-abortion syndrome is a DMS, DSMV, DSM-5, whatever, the diagnostic mental health book, mental illness. However, there are millions of men and women who have experienced trauma related to abortions. And then it talks about lying about risks of substance abuse and self-harm. And look, we can do an entire podcast episode on the data related to suicide, the data related to substance abuse, the data related to self-harm. You know, there was a pro-abortion researcher who set out to do a study to prove that there were no negative mental health implications related to abortion. What he found was the opposite of what he set out to approve. When he went to publish his paper, they said, "You can't publish this." Like it flies in the face of everything that we're trying to say. And he said, "Well, I have to publish this because it's the truth. You know, I don't want to because I'm a pro-abortion. Like I believe that abortion should be legal. However, this is the data, and I'm a scientist." And it ended up getting published. And I think we will do a podcast on that, and we'll share that study and the other studies and get into that. But the idea that it doesn't exist is just a lie. You know, again.
Well, and we have seen too. I mean, you've experienced it. You've had conversations. I've had conversations with folks that are post-abortive, and to argue that there's no lasting ramification is not just lying. It is like it is like being so blinded by your position that you refuse to see reality.
Right.
And it's the same thing. Of course, we've seen this in our culture. It's the same thing that a man can put a dress on and say he's a woman, and there's people that are like, "Oh, yeah, he is," and you know, he's quite attractive. And it's like you are denying reality, what's in front of your eyes right now. And so how I know this is there's even pro-abortion folks that have opened up counseling services for those that have an abortion because they needed what? Like, why would you do that if there's not lasting ramifications? And
Right.
and then I have friends that have gone into prisons and provided post-abortion care. And what they're finding is women and men in prison, the reason why they're in prison stems from an abortion.
Yes.
It was the beginning spiral for them. And to act as if that is not the case, again, is not being helpful to your neighbor. It's not being helpful to society. It's certainly not, celebrating women. It's not healthcare. We need to be able to say, if women are having babies and have postpartum issues after having a child, then of course there's lasting ramifications if you end the life of that child. That's and right. What will come down the road from that. And again, it's not helpful to act as if that's not happening around us. And I've seen it firsthand. And so anyone that would write that down and say there's no lasting ramifications are just lying to themselves and haven't actually talked to someone that, I mean, I could get 10 people on the phone right now that could tell you what it did to them and what it's done for their entire life and the choices and the ramifications from that decision, whether it been 30 years ago, 10 years ago, 50 years ago.
Yeah, and there's thousands and thousands of videos out there now of people talking about this. Like it's not hard to find the reality of the situation. I'm only going to go into two more because we're running long, but I think that these really get into the heart of how just blatantly disingenuous and ridiculous this entire fact sheet is. Staff are rarely medically trained, and as we said, there are 10,000 medical professionals among the 2575 pregnancy resource centers. And then it says, and in one report, a CPC staff member performing a sonogram identified a woman's IUD as a fetus. Okay. All I'm going to say on this is there are multiple instances of Planned Parenthood killing people, like women dying at Planned Parenthood. I will be linking 3 stories in the show notes of women who died at Planned Parenthood. And their entire criticism is that one time somebody on an ultrasound saw an IUD and thought it was a fetus. I think if you're killing people, you need to focus on what you're doing and not being worried about, hey, you know what? We thought she was pregnant, but it was an IUD. Like that's not, it's not on the same level. And I think that it's really important that we're being honest here.
Well, and again, no one is claiming that everything a pregnancy center does is perfect. No one claims that the doctor's office down the road, everything they do is perfect.
Right.
I have friends that have ended up having cancer and a doctor missed it. Like these things happen. But to say that most of the staff is not medically trained, yeah, I led a pregnancy center. I was not medically trained. The person that answered our phones at the front desk wasn't medically trained. But you know what? If I went to the local doctor's office here, Family Doc or the OB, the person answering the phones, they're not medically trained.
Nobody at my wife's office went to dental school except her.
And so again, it's an argument that isn't based in reality because we accept it everywhere else. Everywhere else we accept it. But at the pregnancy center, it's like everyone you come in contact with at the pregnancy center needs to be a doctor. And we don't require anyone else to do that.
Right.
And because the pregnancy centers have folks, volunteers or staff members that didn't go to medical school on staff, look, I can assure you those non-medical people are not giving ultrasounds. They're not doing medical things. They're just not.
That's right. This last one is laughable. I'm only going to read it because it's funny. Their tactics target low-income people or others without regular access to healthcare through strategic advertising online in poor communities. Look, dude, like Planned Parenthoods are purposefully set up in the lowest income neighborhoods to target low income people. It doesn't make any sense that someone, Olivia from the intern department, thought it was a good idea to put this statement in there, like pot.
Yeah, I think that was supposed to. I think that was supposed to be on the fact sheet for Planned Parenthood. They just accidentally put it on the wrong one. And again, we have that. That's like saying, Burger King sets up shop in places where people like burgers and like to get their food fast. Of course they do.
That's right.
Like this is not. It would be crazy to set up a pregnancy center or any clinic of any kind in an area where there's nobody around. I mean, it's just.
But you put the services where the people are who need the services.
Exactly. Of course.
People who aren't low income are just, if they're pregnant, they're going to their doctor, right? They're not seeking free services to determine whether or not they're pregnant, how far along they are. Like that's just not something that happens.
Well,
why would you?
To give you an example of that, our pregnancy center was built in 1997, the one that I led in Knoxville. You know where it was built? Right across the road from an abortion clinic. And so to say they would say we picked a certain area. Well, y'all were there already. So
and many
if you're
pregnancy centers choose those locations on purpose.
Of course.
Like they choose locations as close to the abortion facility as possible. So that's a really good point. I'm glad you brought that up. Like you were there first. You chose low income area. We just chose to be by you.
Well, and it's not that difficult to do a mapping, and we've done it, where you see where the abortion clinics are, and they're in very specific communities. And now I could take that further, and we could spend a whole show on why they pick the specific communities that they pick, versus we're trying to get people to celebrate life and to have babies. They're trying to get certain demographics to not have more children. And I'll leave it at that.
Okay, so we are running long today. I think the best thing to do here is to run through the data from the Lozier Institute report, but not get into the particulars of the services. I think that pregnancy centers are such a huge benefit to the communities and to the pro-life movement that that we should probably have a separate conversation on getting into the types of services they provide. I know that you have been working hand in hand with Bright Course, who provides services for pregnancy centers, to share a program that you created. But that's just one of many. And so I think we could do a whole episode on the actual services that pregnancy centers provide. But just to counteract, at the end of providing, all the false and misleading information that Planned Parenthood provides in their fact sheet, to kind of run through what did pregnancy centers actually do in 2024. And I want to backtrack just a second. I kept saying 2,575 in the United States. The number is actually 2,775 in the United States. So in 2024, pregnancy centers saw or provided 3,799,000 client sessions, and received a 98% positive experience satisfaction rating. And then if we get into $450 million is the total value of free goods and services provided to pregnancy centers. RN hours, we talk about medical professionals. So we have RN hours providing STI and STD testing, 108,000 hours of nursing hours, RN hours providing ultrasounds, 636,000 hours of nurses providing ultrasounds. These are medical professionals. Clients.
That seems like large numbers for non-medical folks.
Right.
Yes.
So there's like 5 nurses who travel around to the 3,000 pregnancy centers and just provide thousands and thousands of hours each of these services. Clients receiving attending prenatal and parenting education courses, 400,000. Clients receiving after abortion, post-abortion support, 25,000. Now we talk about Planned Parenthood saying that nobody's suffering from anything after an abortion, and yet 24,000 clients received post-abortion support just in 2024.
And that's just in the pregnancy center. So we know there are multiple ministries that are doing that service outside of the pregnancy center. Like I said, I know people that are going into the prison that's not part of that number. Yeah. So that number is much higher, but 25,000 within the pregnancy center is pretty remarkable.
That's right. Here's things that Planned Parenthood doesn't provide. Packs of diapers in 2024, 6,353,000 packs of diapers in 2024, 1,600,000 packs of wipes, 40,000 new car seats. All of this is free to the people who come into the pregnancy centers. Baby clothing, 5 million outfits provided. Wow. 36,000 strollers, 24,000 new cribs, 373,000 new cans and bottles of infant formula. So, just to get into, just to kind of to sit on that, because there's a lot more data, but we are out of time. and don't want to, drag this on too long, I think that's the heart of it, right? Like, it's not just prenatal care. It's not just pregnancy tests. It's not just ultrasounds. It's not just you only care about the baby until it's born. What happens after the baby's born? 6,353,000 packs of diapers, 1,604,000 packs of wipes, 40,000 car seats. These are not things that Planned Parenthood is providing, because Planned Parenthood doesn't have to provide services after the baby is born, because Planned Parenthood's job is to make sure no baby is born.
Well, and if you've never handed a car seat to a family in need, you have no idea the difference that makes. You have no idea. We take so much for granted, and the abortion industry is not about providing baby showers and celebrating these women and celebrating pregnancy. That is just not what their mission is. And so if anyone doesn't care about baby after it's born, it's the abortion industry, because the last thing they want to happen is that baby to be born. And so hats off to the pregnancy centers out there that are doing God's work, that are handing those diapers, handing those wipes, handing those car seats and cribs and strollers. And on top of all of that, providing the medical care and the services that they need at no cost to the client, at no cost to the taxpayer, at no cost to the community, and continue to get up every day, day in and day out, and do the hard, heavy lifting. It is an honor to be considered a part of this group. And I'm glad we did this today, Sean.
Yeah, me too, man. And the only, just to the point you just made, I think that this is the last data point on here, is 65,000. That is the total number of workers in pregnancy centers in 2024. 72% volunteers. Mm-hmm. These are people who are volunteering their time, they're volunteering their heart, they're volunteering their energy, they're volunteering their money in order to help people, because they believe that every life is worth living. And I can't say what Andrew said any better than he said, so I just want to echo that sentiment as well. And, I think one of the most telling things about doing this today is the recognition that we can't fit it all in an hour. Like, what pregnancy centers are doing is such a big deal that it's going to be more than one conversation. And I'm looking forward to having that next conversation, or however many we have to, until we put it all out there. So I appreciate you, man. And I appreciate everybody working at pregnancy centers and everything that you guys do. And I look forward to doing this again.
Absolutely.